Okay. Good morning, everybody. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Tasha Sizemore, and I welcome you to the public hearing to discuss the division's preliminary rate decisions for 2023 health benefit plans. The division holds hearings on all individual and small group health group rate filings. Each hearing is generally limited to discussion of the division's preliminary decision and final objections regarding the filing. The hearing will also include a presentation by the carrier about plan changes, including network, benefit, and cost share changes. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the filings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, division actuaries considers such factors as recent and projected medical, hold on, my thing jumped. Recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios. That's how much of every premium dollar goes to pay healthcare claims costs to ensure that the requested rate is not projected to trigger federal rebates or payments from other federal programs. We also look at the history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company and administrative costs. Division staff also ensure that the rate filings meet all the requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request for all of these companies on our website. Thank you, Steve. We have folks mute. You can review the full rate request for all of these companies on our website, OregonHealthRates.org, and all communication for every health insurer rate change filing, including the written answers to all of our questions asked during the review period, are posted there as well. In this hearing, we are discussing, in this order, the preliminary rate decisions for the division has made on small group health benefit plans filed by HealthNet Health Plan of Oregon, United Healthcare Insurance Company, and United Healthcare of Oregon Incorporated. Our agenda for this morning will be representatives from each company will make a presentation and describe their rate requests. The division staff will then lead a discussion about the division's preliminary decision on each filing and the preliminary decisions. Finally, we will accept public testimony. We don't have anybody signed up to take public testimony, but if you would like to make a comment on a company's filing, please unmute and introduce yourself and make your comment. Comments will also be accepted online through 11:59 p.m. today, July 28th. The division will make a final decision about these rate filings shortly after the public comment period ends on July 28th. HealthNet, please begin by introducing yourself and sharing your presentation and explaining your rate increase. Great, we can see that.
Perfect. All right. Good morning. I'm Doug Hale, the Director of Actuarial Services in representation of HealthNet Health Plan of Oregon. I'm also joined by Dylan McKenzie, our Associate Actuary, and we're delighted to speak on our rate impacts for the first quarter of 2023. So the requested rate action for the first quarter 2023 was a 3.4% rate increase, which consists of a minimum rate increase of minus 3.8% on our Platinum plan and a maximum rate increase of 15.2% on P30 in rating area 5. This rate request also includes the discontinuation of our Community Care 1T product in 2023, which will impact 124 members as of 2022. Our full rate filing impacts 3,172 members as of February 2022. We have a few plan changes that were implemented for the 2023 benefit period. We added a new silver plan, the aforementioned discontinuation of our community care 1T network and plans associated with them. And then we made minor changes to our plans as a result of changes to the 2023 AV calculator and de minimis changes. Here's a brief summary of the changes we made for 2023. And no further changes to our benefits or a formulary or product offerings are planned as of this time. And that concludes our first quarter 2023 rate submission summary.
Okay, thank you. Now, division staff will lead a discussion about the division's review of the filings and our preliminary decisions. So I'll turn it over to the division actuary, which I think is at you, Ying.
Yes, correct. Thanks, Tasha. Good morning, everyone. My name is Ying Liu, and I'm actuary for the division and the primary review of this filing. And I will have the company requested a 1.8% average rate increase for the first quarter 2023 in the initial filing from the first quarter compared to the first quarter 2022, and the minimum rate change is 5.2%. It's actually a decrease, and the maximum rate change is 13.5% increase. And after the initial filing in response to CMS newly released risk adjustment result in the beginning of the month, the company changed the risk adjustment estimate from $32 PMPM receivable to $24 PMPM receivable. With that, the requested rate change becomes 3.4% instead of the 1.8% initial filed. The division's preliminary decision is approved the 3.4% rate change based on our review. Our review includes but not limited to looking at the experience, which is the base period data, and also assumptions, methodology, and calculation. For the experience, the rate change was developed based on the 2021 experience. During the experience period, the company had about 40.5 thousand member months, and the total premium was around $20.7 million. The experience is considered fully credible for the purpose of the rate development. The medical loss ratio was 88.4% before applying a risk adjustment. And the data also, the company for the data excluded the COVID-related cost from the experience period. And the cost associated with that is $20.78. So the purpose is to remove this cost before applying any trend and adjustments. And projecting into 2023, the following are the key items that addressed in the filing. First is 5% pricing trend was projected, and it's varied by medical and pharmacy. Those are consistent with the market average projection. The calculation also accounted for demographic, geographic changes, and plan mix shifts, cost sharing design changes, as well as network adjustment. For the risk adjustment, as mentioned earlier, the company projected a $24 PMPM initially. after the CMS finalized the risk adjustment result, and the initial estimate was $32 PMPM. As mentioned earlier as well, the COVID-related cost was removed from the experience period. And to account for the future cost of COVID, like vaccination costs and continued treatment, estimated cost was loaded back. So it's a $7.80 estimate compared to the $20.80 removed from the base period. The company 2023 target profit is 1.5%. The company's long-term expected profits 3% and expect the COVID-related costs to phase out over time, and then intent will be rebuild those profit margin as the situation with COVID normalize. The filing also include administrative costs, which include expenses, taxes, and fees. As a result, the projected medical loss ratio for 2023 is 84.3%, and the required rate from first quarter 2022 is 3.4%. We consider the above experience and assumption also reasonable and supported. The division agreed on the company's methodology and calculation for the original filing and the update, and the preliminary decision is approved as filed. So that's all from me. I turn back to Tasha. Thank you.
Thank you, Ying. HealthNet, do you have any additional information or comments that you would like to make on these filings?
No additional comments from us.
Thank you. We will now take public testimony. As I mentioned earlier, no one has signed up to testify. So if you would like to, please unmute and introduce yourself. Okay, let me remind anyone listening that July 28th is the last day for public comments. Comments can be submitted through our website, OregonHealthRates.org. Next, we will hear from United Healthcare Insurance Company. We will pause briefly.